Among the most vulnerable people in this crisis are residents of nursing homes and assisted living facilities. NBC News is now reporting that more than 2,200 patients have died from coronavirus outbreaks in nursing homes alone. And there were reports of much higher numbers of fatalities because the federal government no longer tracks these deaths. The tragedy of loss also, of course, compounded by separation, family visits ruled out, loved ones dying without the comfort of their closest relatives. Rosalind Pearson is mourning the loss of her 71-year-old father, Ralph, who was diagnosed with COVID-19. He passed away last week at Canterbury Rehabilitation and Healthcare in Virginia, where 42 residents have now died from the disease.
I don't have my dad, and others don't have their loved ones. There still remains questions on what they could have done differently to prevent this tragedy of unnecessary loss of lives.
And joining me now is Virginia Congresswoman Abigail Spanberger. Congresswoman, thank you very much. I know you're trying to do something about this, looking for more money. How is that going, your efforts to try to secure better oversight of these facilities?
So, Andrea, the heartbreaking story that you just highlighted is one of 42 that we have here in Central Virginia, where family members, loved ones have died of COVID-19 at this one facility. And we have other outbreaks of COVID-19 in other nursing home and rehabilitation centers throughout Virginia. I've been working with our state leadership, and I've also been working at the federal level to ensure that we are making good decisions moving forward to protect people from this type of heartbreaking loss. The Governor Northam here in the Commonwealth of Virginia has established a task force focused on addressing the threat of COVID-19 and outbreaks of COVID-19 in our nursing homes. At the federal level, I have been pushing for additional funding, notably in the CARES Act. There was $100 billion allocated to HHS, and I joined with two Republican Virginia colleagues, another Democrat from Virginia, to ask Secretary Azar to ensure that a minimum of $15 billion goes to our nation's nursing homes and a minimum of $10 billion goes to assisted living facilities. These locations, they need help and they need it immediately. Just also on Thursday, I led an effort for emergency funding to nursing homes, and I had 41 colleagues join me in that effort. They need testing, they need PPE, they need additional money for staffing. What is so tragic is that when one person gets sick in this nursing home, when we look at who is most vulnerable to COVID-19, people, senior citizens, and those with pre-existing or comorbidities. And we are just seeing horrific outcomes when COVID-19 is able to infect nursing homes and kill our seniors.
Well, Congresswoman, just as of Friday, when we were last tracking, there were 84 patients infected there at Canterbury and 25 healthcare workers. We don't know if those numbers have gone up, but has Secretary Azar gotten back to you with any kind of guarantee that that proportion of the CARES Act will go towards these facilities?
We've gotten no response back from the Secretary related specifically to the needs of nursing homes. And while the Canterbury Rehabilitation Center is, at this point, the place where we have seen the most tragic numbers of death, it is an example of what we could be seeing elsewhere if we don't continue to take emergency, immediate action to ensure that we are testing every healthcare worker that is in those facilities, and that this isn't happening just in Virginia, but nationwide, and that we are ensuring that there's the personal protective equipment so that the workers and the healthcare professionals who are working with and providing aid to those who are infirmed and those living in assisted living facilities, that they, if there is a case that is still unknown, that it isn't able to transmit patient to patient via a healthcare worker. The need here is emergent and it is significant. And we have a responsibility, I believe, as a community and as a country to our nation's seniors, for them to be protected in their senior years, and particularly those who are most vulnerable and those who are in locations like nursing homes and long-term care facilities. But I haven't received a response back. I will continue pushing. I'm now asking for an investigation into HHS's use of the Strategic National Stockpile. There's been reports out of a variety of states, including Virginia, that the purchases made by particular states have been taken and diverted. There's also a tremendous under provision. Virginia, for example, has requested PPE, ventilators, other really necessary pieces of equipment, and has received just a small fraction of what's been requested. And what has been requested is what is needed. So we are only getting a small percentage of what is actually needed on the ground to save lives.
Well, please keep us up to date on any response that you get as well. We will keep tracking this. Thank you so much, Congresswoman Abigail Spanberger.
Thank you.